Hi, everyone. This is How to Pass NCLEX. I'm back. It's Monday, so I have your Monday NCLEX activity. Today, we will be studying pharmacology. And come on in, the pharmacology will be coming from Quick Facts. So we're going to run it again. We're going to play this little game where I am the patient. You are live on set, and I'm trying to get you to tell me the medication that I'm taking because I don't remember. I don't remember the medication. And some of you have played this game with me before and you know how it goes. So we're going to roll into it. This is How to Pass NCLEX. I'm back, the #1 NCLEX instructor on the planet. My name is Regina Callion. And if you would like to study with me full time for your NCLEX, please head over to my website. It's remarnurse.com. Our community, we're ReMar nurses. We're here. We're ReMar nurses. We get our license. We pass the NCLEX. So let's go. The first medication, you guys got it really quickly. This is actually not a shirt. It's actually a hospital gown. I'm a patient. And the medication that I'm on, I said it, but I'll say it again, is for congestive heart failure. The doctors wanted my heart to be slower. The doctors wanted my heart to pump more effectively because I have CHF. So the nurse, put the comments on the screen because I know you guys got it. The nurse, before she gives this medication to me, she has to take an apical pulse. What is this medication? Shout out to the Bahamas in the house. Shout out to Jamaica. Shout out to Florida. All of my nurses, we're an international community. Yes, I won't belabor it. Of course, the medication that makes the heart pump slowly, the medication that you need to take an apical pulse for 1 minute is going to be digoxin. All right. The next medication, I'm taking this medication for pain, for acute pain, but I have to be careful because I can get addicted to this medication if I take it for too long. And I could take it PO, I could get this medication IV, but if I'm in the hospital, I'm most likely getting it IV. It's for really bad pain. This medication causes constipation and respiratory depression. This medication, what else? What else, guys? Oh, it's naturally dark brown. If you see it, it's naturally dark brown. What else? And this medication is considered an opioid. What is the medication? I see you guys got it. Some of you guys got it already, and I wasn't able to fool you. Comments on the screen. Share this video too, because this is what we do every Monday. This is our Monday motivation to get our nursing license. Passing NCLEX is the most important thing as far as your career goes right now. There's nothing else more important than that. The correct answer is actually, good job. Good job, Gina. It is morphine. Morphine. Okay, I'm moving on. This is fast pharmacology. Okay, guys, I take this medication for my osteoarthritis. This medication is an anti-inflammatory. You're going to try to give it to me in the hospital, but I could actually buy it over the counter. I don't need a prescription for this medication. And I have to be careful when I take this medication because it can cause GI bleeding. And also, this medication is in Quick Facts for NCLEX. So if you have this book, then you already will know what I'm talking about. This medication that I'm on, I see it already. It's for osteoarthritis. Patients can also use it for rheumatoid arthritis too, because it is an anti-inflammatory and it helps with joint pain. And I'm looking for the generic names only because this is NCLEX. I'm an NCLEX patient. And with NCLEX patients, they know the generic names only. So the correct answer is ibuprofen. Ibuprofen, not Tylenol. Be careful. It is And this is what happens. Hey, Mark, I don't know. It's something with the camera. It's like, I don't know what happens. What about now? Can you guys hear me now? Good? Good. Better? I'm good. Okay. I'm good. I'm good now. We can keep rolling. It's good now. I'm getting the thumbs up. Okay, they can hear me now. I'm rolling. All right. So I am on this medication. Wait, some people are saying the camera.
Keep going.
Okay, I'm keeping Mark said keep going. Okay. So this medication, I have a serious infection, a very serious infection, and I'm prescribed this medication. But before they give this medication, they have to do a culture. You cannot just give this medication without knowing exactly what my issue is. So they've done a culture. They have done a peak and a trough. So I have to make sure that I'm not getting too much of this medication. And this medication can be given multiple routes. It could be given orally. It could be given topically. They could put it on the skin. It is an antibiotic. Okay. It is an antibiotic. It's not penicillin. I'm allergic to penicillin. So this is not penicillin. It starts with a C. It starts with a C. So you can give it orally. You can put it on the skin. You can give it through the IV. You can give it vaginally even. You can give it many routes. Okay. Serious infections only. Starts with a C, not a V. I see the V's, but I need the C's because that's the medication that I'm talking about today. That's the medication I'm talking about. Cephalosporin, no. Ciprofloxacin, no. You got to do a peak and a trough. You got to do a peak and a trough, and it can cause some ototoxicity. Ototoxicity. I see some. Yes. It's clindamycin. It's clindamycin. Clindamycin. Good job. Good job, Lourdes. You got it. Yes. Shireen, you got it. Good job. All right. Comments on the screen. Comments on the screen. Okay. Next medication is this. Okay. This medication, I'm taking it because it lowers my blood pressure. It lowers my blood pressure. It blocks the effects of angiotensin 1 to the receptor sites. Yeah, I said that right. It blocks the effects of angiotensin 1 to the receptor sites. You should not give it in patients who have hyperkalemia or renal issues. I'm going from the Quick Facts book, guys. And valsartan is an example of this medication. What is it? What is it? I'm looking for it because not beta blockers. Not beta blockers. I said it blocks the conversion of angiotensin 1 at the receptors. It blocks that. Lisinopril, ACE inhibitors. No, I'm looking for it. Did somebody put it down? Yeah, valsartan, losartan is yes, it's ARBs. It's ARBs. Make sure you guys know that. Okay, that medication does lower the blood pressure. Okay, good job, ARBs. I was trying to see what page that one. If you know the page for ARBs and Quick Facts, just let me know because I know I'll literally I won't ever find it just because I'm looking for it. Okay, next medication is this. Okay, this medication, I'm allergic to penicillin. So if a person is allergic to penicillin, they cannot take this medication. It is for gram-negative bacteria. So that means that this is an antibiotic. Yes, it's an antibiotic. It's for gram-negative bacteria. Don't give it if the person is allergic to penicillin. Also, it can cause hyperglycemia. So if you're taking this medication, then you can have a false reading of hyperglycemia. Okay, page 94. Is that 94? No, it's not 94. Does anybody know what it is? I said if, oh yeah, you guys got it. You actually do know what it is. Yeah, so for the people who are not reading the comments because you guys got that pretty fast. So it's for gram-negative bacteria. You cannot give it if the person is allergic to penicillin. It can cause false hyperglycemia readings. And also thrombocytopenia is a risk too with this medication. And absolutely, you guys got it right. I'm not worried about the spelling. Cephalosporins is correct. Good job. Good job. Okay, we are moving on. We are moving on. Next medication. This medication is given and it increases my physical stamina. When I take this medication, I could just go. I can go for my daily walk. I could study. My mind is just clear. It's good. I am good when I take this medication. It also is, but it increases my risk for bleeding. It increases my risk for bleeding. So I love it because it gives me energy. It also decreases the ringing in my ears. It also increases the ringing in my ears. So hold on. They're saying, can you guys hear me? Somebody's saying they can't hear me. I just want to check. We should be good. We should be good on that. Good? Are we good? Yes. Yes. So the correct answer is ginseng. The correct answer is ginseng. Good job. Good job. Okay. All right. So that was ginseng, a natural alternative. Now the clues for ginseng were that it increases bleeding. So remember, guys, any herbal medication that has the letter G to start, ginseng, garlic, ginkgo biloba, these all will increase your risk for bleeding. So just keep that in the back of your mind. It makes it easier. All right. Good job. Natural alternative. I'm moving on. You guys ready for the next one? Okay. The next one is this. This is it, guys. This medication has a peak in 2 hours. And you can give it IV. You never would give it IM. Never give it IM. You need to give this medication around food. And you have to use a certain syringe to give this medication. So when I get this medication, I can get it IV, but I usually don't get it IV. I usually get it injected in another way. I'm making it harder. Oh, you guys got it. You guys are not fooled today. You are not fooled today. Yeah, I see it. The answer, all right, for the medication that has a peak of 2 hours, that has to be given in 100-unit syringes and scheduled around meal times, and you got to rotate the injection sites. Yes, absolutely. You guys got it. It is regular insulin. It's regular insulin. Oh, man. You guys really, I thought I was really going to be stumping you guys today, but you were ready for me today. All right, but as I was saying, I got these medications from the Quick Facts for NCLEX, and this is a great way to test yourself if you have this book. Just grab a buddy, grab a friend, and have them ask you questions from the pharmacology section, because the teaching is the most important part. It is so important. All right, let me see. So do I have another one that I want to give? Okay, come on. Let's keep going because I was going to be done. I have somewhere to be, but I'm having fun studying with you guys. All right, here we go. Which medication is this? You cannot give it before an intravenous pilogram. All right, this medication and the dye can cause kidney failure. And it is a medication that is going to help to lower your patient's blood sugar level. But specifically, you have to be a type 2 diabetic. And also you have to not give this before the IV pilogram. And I'm getting it from here. So I see the answer on the screen already. Jasmine, you must got out your Quick Facts book because you are super fast today on these comments. All right. So the correct answer, though, for this is going to be glucophage. Glucophage. People say it, glucophage. All right. Not metformin. All right, let's go, let's go, let's go. This medication is given during labor. It helps to stop labor that's happening, but you have to monitor your patient's urinary output levels. What medication is that? It's given during labor, and you have to measure your patient's urinary output levels because it can affect urine output. What medication am I talking about? Do you guys know? It can decrease urinary output levels. Yes, it's very important to know what medication I'm talking about. And it's not Pitocin. It's not Pitocin. It's when you want to stop the labor. It's when you want to stop the labor. I see the answer on the screen. Oxytocin, not quite oxytocin. Comments on the screen. I got almost 400 nursing students studying with me for NCLEX. That's fantastic. The correct answer is absolutely magnesium sulfate. All right, here we go. I'm moving on. Magnesium sulfate depresses your urine output. It depresses the respirations, and it also depresses the reflexes of that pregnant client. So make sure that you know that. All right. This medication, if my patient is taking it, they cannot have anything with tyramine in it. What is the medication? That means they cannot have any red wine. They cannot have any cheese, sharp cheddar. They cannot have macaroni and cheese, which is one of my favorite foods. If you are on this medication, you cannot have macaroni and cheese. No coffee, no tea. I'm also a big tea drinker. This medication as a patient is very difficult for me to take because you can't have all the things that I like. What is that medication? Absolutely. It is a MAOI. MAOI. Absolutely. Good job, guys. All right, moving on. This medication that we have coming up, okay, this medication that we have is used. This medication is used and it protects the stomach. It helps with the protection of the stomach lining, and it is given by mouth on an empty stomach. And so sometimes when patients have peptic ulcer diseases, we give this medication, and it is used. That's all I can say. It protects the lining of the stomach, and it's in here. It's very important, and it's very common that patients get this. Yes, I see it. I see the answers on the screen. You guys know this. If you don't know this, this is on page 93. It's on page 93 of Quick Facts, and it is the sucralfate, right? It's the sucralfate. Yeah, very not talked about a lot, but it does have a very important function. Okay, so study page 93 if you didn't get that one right. Okay. No, I don't want to do that. Oh, yes, I do. No, I don't want to do that one because we already talked about it. All right, here we go. Which medication can be given during pregnancy to help patients? They help to prevent blood clots in patients. And something specific about it is that it can be given during pregnancy because it doesn't cross the blood-brain barrier. Which medication is that? Because there's a lot of options that you can give to prevent blood clots, but there's only one that is safe during pregnancy. That's important. I want to see the answers on the screen. And let me say, it does have an antidote. It does have an antidote to this medication. Ooh, you guys got it. You are good today. If I was a patient and I did not know these medications, you guys would absolutely be able to help me out. Okay, cool. All right, here we go. Next medication is this. Oh, okay. This medication can be used as a sedative. It makes you drowsy, to be honest. It's supposed to be used for allergic reactions, but it is also given for motion sickness and when a woman is pregnant and she's nauseated, she can also take this medication as well. It's over the counter, and it can also be used to reduce nausea in cancer patients. Seriously, it's really good. It's really good for the nausea part, but it makes you so drowsy. So once you take it, you cannot, you should not really be driving around. At least that's my experience with it. When I take it, it makes me super tired. It makes me super tired. All right. The correct answer is what we say, diphenhydramine or Benadryl. Yes, absolutely. Yes, 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 yes. That is the correct answer. It can be used for motion sickness, pre-pregnancy nausea. It can be used for cancer patients. And I know a lot of people are putting promethazine, which can also be used for nausea, but you can't get promethazine over the counter. You can get this stuff over the counter. And so whenever you're buying this, usually if you're in a pharmacy, they ask you your age because people can abuse this medication for sure. All right, guys. Okay, so this is the quick facts for NCLEX pharmacology. I just wanted to come on. Shantae says, I knew it. I just could not spell it. I hear you. I'm with you on that. A lot of you guys purchased this during our Black Friday or our Cyber Week sale. So when you get this book, this is my favorite way to study it. It's like reading a couple pages and then going to grab somebody and getting you to quiz yourself on the information that you studied. It is super important for you to do that. Petal says, hey, Regina, I remember when you visited Jamaica. Great lesson it was. Quick Facts was a big help. Awesome. Love Jamaica. Can't wait to go back. I actually was just in Jamaica in July. So I'm counting down the days till I can go back there again. Such a beautiful island. But yeah, so Quick Facts for NCLEX is a really great way for you to just pick up and study. And I will definitely be studying more of this with you guys personally. But remember, the work you do at home is what helps you to pass NCLEX. So study sessions with me are great. Get in the virtual trainer and get the full NCLEX review and make sure that you're studying your Quick Facts book as much as your schedule allows. If you have the virtual trainer, there's a daily study calendar in there. Take advantage of that daily study calendar because I tell you exactly what you should be studying every day. And then I also incorporate the Quick Facts into that study session. So you should be studying these two books together at the same time. A lot of students make the mistake of just studying Quick Facts by itself or just doing the virtual trainer workbook by itself. That is going to take so much longer as is if you were studying it together. Okay. And I see all the testimonials. Clavine says, I claimed and I passed my NCLEX. I'm officially a registered nurse. Thanks, Mark and Regina. Amazing. Can you please send me your testimonial video or just you're on Facebook. So just send me a message and let us know. Okay. Because I want you to have a t-shirt, a ReMar nurse shirt as well. I am Nurse Bailey. You are my motivation for today. Oh man, amazing. So yeah, this is how it works, guys. Okay, so you do a little bit from the VT, you do a little bit from Quick Facts, and it doesn't have to be long. What we just did today, 23 minutes. Look at all the medications we covered and talked about, and we incorporated the symptoms and the diagnosis. That is how your studying should be for NCLEX. It does not have to be boring. It does not have to be burdensome. If you feel like this is boring and it's not fun for you, stop it, because you're not going to remember, you're not going to retain, and you're just going to be wasting your time. All right. And this is not about wasting time. This is about you getting your license as quickly as possible. That's it. How do you study both with the online virtual trainer? So if you need to have the program, go to remarnurse.com and you can sign up for the virtual trainer. Tonight, I will go live and I will talk about how to log in, how to get started, where the study calendar are. So if you want what study calendar is, so if you want me to answer specific questions, please send them. If you're on Facebook, send them to the team Send me a message. Tell me the questions you want me to answer tonight. And then also, if you are watching from YouTube, please email me support@remarreview.com, support@remarreview.com. Somebody put that in the comments, and I will also address those questions too. Katura says, I love the virtual trainer so far. I got it Black Friday. Yes, 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 yes. That's what I'm talking about. You guys making that commitment, jumping in and on your way to your nursing license. Literally, there are just, 3 weeks left in this year, and then we're into 2022. So, guys, I'm telling you, now is the time to make sure that you are capitalizing on the final weeks of this year. 2022 is going to be such a huge year for nurses. It's going to be such a huge year for nurses. You guys want to get in on it. I truly believe that we are going to be seeing a demand like none other. Hospitals are already lining up jobs for nurses in school, right? Oh my goodness. So please don't neglect this nursing license. Don't neglect your NCLEX. Don't put it off. I cannot tell you. My sister is she's in nursing school right now. Her program is super fast, but they are already like offering her jobs. Like, it is incredible. And I want you guys to have that same experience. I want you guys to know in 2022, your life is changing for sure because you're a nurse. Okay. So tonight I'm going to try to go on about 8 p.m. Eastern time. You guys know I have 3 kids. So if I can get them settled, I can hop on here. But yeah, they're just my priority. So whenever they are settled and at peace, then I can come on here. Jeanette says, crazy question. The virtual trainer, is it a book or is it online? That's not a crazy question. That's a fantastic question. The virtual trainer is actually a combination program. It is a full review. So it comes with books, right? These are the 2 books that I send, but it is also an online platform where you go in and you take classes just like you would if you were in a nursing program or a nursing curriculum. You have the ability to watch my lectures, and then also you take notes in your workbook that I send to you. So it's both. Clavine says, get out of your comfort zone, believe in yourself, and try ReMar. Mona, you say, I got my program last night. You're still waiting for your virtual trainer. How much is it? You gotta, is there a coupon code they can use right now, Mark? ReMar Nurse. Okay. If you go to the website, remarnurse.com, and you put in the coupon code ReMar Nurse.
I don't think it's having money change, so.
Oh, really?
Just go right now, it's better.
Oh, okay, never mind. Just go right now. Mark said we didn't take the sale down, the last sale down. So just go ahead and go right now and get it today, okay? Because that sale price might be changing. I don't even want to say what it is. Just go. All right. Because we did do a really huge sale for Cyber Week, which was last week. All right. So yeah. So again, I wanted to just show this really quickly. The virtual trainer is a combination program. So you have the books, and you also have an online platform that you go into, and you are literally able to watch your reviews, your videos, take practice exams. You guys who have it, you know, you can do it from your cell phone, you can do it from your tablet, you can do it from your laptop. So that is what the virtual trainer is. So I will be going more into it tonight. Okay, around 8 o'clock. So I passed NCLEX RN after trying ReMar, VT, and QuickFacts. Yes. First shift. Do I have? Okay, first shift. They're asking about first shift. So first shift is my book, and it is the one that I wrote to help nurses transition to the floor. So these are my books to transition to the test, and then after the test, or even I have nursing students who use it for their clinicals. This is how to be a effective, amazing nurse. So, for example, I'm telling you the stuff that I wish my preceptor would have told me when I was a new nurse. My first nursing job, it was very tough. It was very tough for me to manage my time, to know what to say, to interview for the job. So the chapters in this book are dominate the job search, dominate the job interview. I have been interviewed a lot of times as a travel nurse, and nurse managers ask the same questions, right? They ask the same questions. And so I tell you what questions they ask and how to answer the questions as well. Dominate the job acceptance offer. There is a way you should accept a job offer. There are things you should look for. There are questions you should ask. Oh my goodness. Also, dominate the orientation period. Did you know that when you get hired as a nurse, the first couple of weeks, you should be sitting in a classroom. You should be sitting in a classroom learning about the policies, learning about the equipment that you're using, learning about the protocols. That is the orientation period. If your orientation period looks vastly different than that, you should have some questions to ask. Okay. Dominate the shift assignment, dominate your patient introduction. When you first meet your patient, how do you approach them? What do you say to them? My philosophy is this. When I first meet a patient, I am setting the tone. I am setting the tone. This is also on remarnurse.com. I want that patient to understand who I am, what I am there for, and what my duration will be like. So I let the patient know, hi, my name is Regina Callion. I'll be your nurse today. I'm going to pass medications with you. I'm going to do some teaching. I'm going to tell you what the doctor has in store for you today. I'm here with you from 7 p.m. to 7 a.m. We are going to accomplish these goals together. This is the conversation you should have with your patient. So your patient understands that your primary job is not there. Your primary job is not there to clean the room. It is not there to sit and discuss their marital issues it's not there to talk about, their children's substance abuse problems. You really have to be able to set the tone and command your shift. And so, first shift does that. It really does that. And again, it's just the things that I tell nurses that I precept. It's the things that I would want to tell you. So that's one of the chapters. I also have dominate the, what is it called? Dominate speaking as a nurse. Oh my goodness. As a nurse, you have to speak to the physician. You have to speak to the family. You have to speak to laboratory, right? There is a way that you speak to a doctor about your patient. And it is not, we learn SBAR in nursing school. And I got to go. I really have to go, but you guys started me up on this. SBAR is great, but there's a lot of gray areas about SBAR, okay? And so when the doctor is hostile because he's upset about something and he brings that energy to the nurse's station, and you have to communicate with that doctor, what are some things you should do? Okay. So dominate the handoff report. Doggone it. The handoff reports from new nurses are notoriously terrible. How do I know this? Because I am once a new nurse. I was once a new nurse, but I'm always learning. But I was once a new nurse, and my handoff report, it was not very good. It was not very good. So I tell you what the things to say for your handoff report. Dominate your nursing career and personal life, because now I have one more book to read. First shift. I'm telling you guys, first shift. It is that book. If you're a new nurse, you need to get ready for your first shift. All right. And that is a whole bunch of stuff. That's how to get the job and everything like that. So it is a book. It's on the website, remarnurse.com. And I highly recommend it to anybody who is going to be working as a nurse, who wants to know the ins and outs. And I like to say I have a pretty good nursing career. I'm doing what I love to do on my own terms, in my own way. And I think that is what it's about. It is about owning your nursing career. And if you want to do that, this book will help you to get there. Okay, guys. So remarnurse.com, head there if you don't have the virtual trainer, because apparently the Cyber Week sale is still going. But also you can also get out the first shift if you're interested in that. Quick facts. Somebody else mentioned my other book, which is Quick Facts for Teas and Hesse. if you're preparing for this exam, this is also going to be a great resource for you. In this book, I go over science, math, reading, and English language, which you guys know you need for the T's or the HESI, but mostly for T's too. That's what I focus on here. So yeah, these are my products, how I help nurses, and I hope that I can help you too. And I say this all the time, but I truly believe it. If you're studying for NCLEX, you can, you will, and you must pass NCLEX. Later, guys.